The relationship between diet and the development of diabetes is a topic of great importance because diet plays a fundamental role in the predisposition and control of this chronic condition. Diabetes mellitus, often simply called diabetes, is a metabolic disease characterized by high levels of glucose in the blood due to problems in the production or action of insulin, a hormone that regulates the entry of glucose into cells. There are two main types of diabetes, type 1 and type 2. Type 1 is an autoimmune condition in which the immune system attacks and destroys insulin-producing cells in the pancreas, making the patient dependent on insulin to survive. Type 2, on the other hand, is more common and is strongly related to lifestyle, including diet. Here are the main ways in which diet can influence the onset of diabetes. Glycemic Index, GI, of foods. GI is a measure that indicates how a food affects blood sugar levels. Foods with a high GI, such as refined sugar, white bread, and French fries, rapidly raise blood glucose, which can lead to spikes and drops in insulin levels. Over time, this can contribute to insulin resistance, a major risk factor for type 2 diabetes. Consumption of simple sugars. Excessive consumption of simple sugars, found in sodas, sweets, and processed foods, can lead to a significant increase in blood sugar levels. The pancreas responds by producing more insulin, which over time can lead to insulin resistance and type 2 diabetes. Obesity, a diet rich in empty calories and high in saturated fat, can lead to weight gain and obesity. Obesity is a significant risk factor for type 2 diabetes, as excess fat, especially abdominal fat, is associated with insulin resistance. Fiber and complex carbohydrates, a diet rich in fiber, found in foods such as whole grains, fruits, vegetables, and legumes, can help regulate blood sugar levels. The complex carbohydrates in these foods are digested more slowly, preventing sudden glucose spikes. Healthy fats, unsaturated fats found in avocados, nuts, seeds, and olive oil can help improve insulin sensitivity and reduce the risk of type 2 diabetes. In contrast, saturated and trans fats found in fried and processed foods can increase the risk. Portion sizes and weight control. Portion size and weight control play a crucial role in diabetes prevention. Excess calories, regardless of the source, can lead to weight gain, which increases the risk of type 2 diabetes. Alcoholism. Excessive alcohol consumption can affect pancreatic function and lead to problems with blood sugar regulation, increasing the risk of developing diabetes. Healthy eating habits. In addition to the types of foods consumed, how food is prepared and eating habits also play an important role. Eating a balanced diet, avoiding overly calorie-rich meals, and practicing mindful eating can contribute to diabetes prevention. It is important to note that genetic predisposition also plays a significant role in the development of diabetes, and not everyone who follows an inadequate diet will develop the disease. However, choosing a healthy diet and maintaining a proper body weight are essential steps in preventing type 2 diabetes, especially for those with a family history of the disease. In summary, diet plays a crucial role in the onset of diabetes, especially in type 2 diabetes, which is strongly related to lifestyle and diet. Adopting a balanced diet rich in whole foods, fiber, and healthy fats while avoiding excessive consumption of simple sugars and saturated fats is essential in preventing this chronic condition. Additionally, maintaining a healthy body weight and adopting mindful eating habits are important steps in reducing the risk of developing diabetes. Some foods and eating patterns can increase the risk of developing type 2 diabetes when consumed in excess or inappropriately. Therefore, it is more appropriate to discuss foods and habits that can contribute to the development of diabetes when they are not part of a balanced diet. Here are 10 of these factors. Refined sugars. Consuming excess refined sugars, such as those found in candies, cakes, sodas, and other sugary products, can lead to blood sugar spikes and, over time, contribute to insulin resistance. Sugary beverages. Drinks like sodas and sugar-added fruit juices are particularly problematic because they provide large amounts of sugar in an easily absorbable form, leading to blood sugar spikes. Saturated fats. A diet high in saturated fats, found mainly in fatty meats, full-fat dairy products, and fried foods, can increase the risk of type 2 diabetes, possibly due to its impact on insulin resistance. Trans fats, artificial trans fats found in many processed foods, such as commercial baked goods and fried foods, are associated with a higher risk of diabetes. Ultraprocessed foods, rich in added sugars, unhealthy fats, and additives, are often deficient in essential nutrients and can contribute to weight gain and metabolic problems, including diabetes. Processed meats, excessive consumption of processed meats, such as sausages, bacon, and ham, can increase the risk of type 2 diabetes. Refined carbohydrates, foods made from white flour, such as white bread and refined pasta, can raise blood sugar levels when consumed in large quantities. Lack of fiber, a diet low in fiber, found in fruits, vegetables, whole grains, and legumes, can contribute to insulin resistance and the development of type 2 diabetes. Lack of portion control, overeating any food, even healthy ones, can lead to weight gain, increasing the risk of type 2 diabetes. Unbalanced eating habits, unbalanced diets that do not provide all the essential nutrients the body needs can lead to metabolic problems, including diabetes. It is important to emphasize that diabetes is a complex condition, and the relationship between diet and diabetes is multifactorial. Prevention and control of diabetes involve more than just avoiding certain foods. They include adopting a balanced diet, maintaining a healthy body weight, and engaging in regular physical activity. It is recommended that anyone concerned about diabetes consult a healthcare professional or a nutritionist for personalized guidance based on their specific situation. Diabetes mellitus is a chronic disease that affects the body's ability to regulate blood glucose, sugar, levels. When not well controlled, diabetes can cause a range of significant health problems. Here are the main problems caused by diabetes. Cardiovascular complications. Diabetes is a major risk factor for heart diseases. People with diabetes are more likely to develop high blood pressure, coronary artery disease, angina and heart attacks, and stroke. Diabetic retinopathy. Diabetes can damage the blood vessels in the retina, leading to diabetic retinopathy. This can result in blurry vision, blindness, or other serious eye problems. Diabetic nephropathy. The kidneys can be affected by diabetes, leading to diabetic nephropathy. This can result in kidney damage, kidney failure, and the need for dialysis or kidney transplantation. Diabetic neuropathy. Neuropathy is a common complication of diabetes that affects nerves. It can cause symptoms such as numbness, tingling, pain, and weakness in the extremities, as well as digestive, bladder, and sexual function problems. Diabetic foot. Neuropathy and poor blood circulation in the feet can lead to wounds, ulcers, and infections that can be difficult to treat. In severe cases, this can lead to amputation. Skin problems. People with diabetes are more susceptible to skin infections, such as boils and fungal infections. Additionally, the skin can become dry and cracked. Impaired wound healing. Diabetes can affect the body's ability to heal wounds, increasing the risk of infections and complications following surgery. Dental problems. Diabetes can increase the risk of dental issues, including periodontal disease, gum disease. Sexual problems. Men with diabetes may experience erectile dysfunction, while women may have problems with vaginal lubrication and reduced sexual desire. Mental health problems. Diabetes can also affect mental health. The stress associated with managing the condition, along with fluctuations in blood sugar levels, can contribute to anxiety and depression. Other complications. In addition to the problems mentioned, diabetes is also associated with a higher risk of general infections, digestive problems, memory and concentration issues, and an increased risk of certain types of cancer. It is important to emphasize that proper control of blood glucose levels, along with a healthy lifestyle, including a balanced diet and regular physical activity, can help prevent or minimize many of these complications. Regular medical checkups and adherence to the treatment plan are essential for effectively managing diabetes and preventing these health problems. Each individual with diabetes should work closely with their healthcare team to keep their condition under control and avoid complications.